a very highly significant result here in favor of dapagliflozin. Patients treated with dapagliflozin having a 25% relative risk reduction, again with highly significant p-value, and again with the curves diverging early. You recall that when we started this, we talked about the fact that there are several key goals of management in patients with heart failure, one of which is to reduce death and hospitalizations, and the second one is to improve symptom burden, reduce physical limitations, and improve the quality of life. So one of the pre-specified secondary outcomes in DAPA heart failure trial was the effect of dapagliflozin on the Kansas City Cardiomyopathy Questionnaire, or for short, KCCQ. And KCCQ is a gold standard of assessing patients' health status as it relates to heart failure. In this study specifically, the pre-specified secondary outcome was what we call a total symptom score, essentially measuring symptom burden of heart failure. And when you look at the Kansas City Cardiomyopathy Questionnaire, what's considered to be a clinically meaningful change is at least 5-point or greater improvement in a positive direction, or 5-point or greater worsening in a negative direction. There were significantly more patients treated with dapagliflozin as compared with placebo that experienced a clinically meaningful improvement in symptom burden. Again, you can see a highly significant p-value. And there were significantly fewer patients treated with dapagliflozin that had a clinically meaningful worsening in heart failure symptoms, again with a highly significant p-value. This was worsening renal function endpoint, defined as a composite of sustained 50% or greater reduction in eGFR, progression to end-stage kidney disease, or death from renal causes. Now I will remind you that this was not a renal outcome trial, it was a heart failure outcome trial.